Thank you for joining us for Health Talks. I'm Gail Hogan, and uterine fibroid expert Dr. Amber Bondurant is here to talk about fibroids, the latest treatment options, and the expertise found only at Ohio State. Welcome, Dr. Bondurant. Thank you for joining me.
Thank you.
We're talking fibroids. What are they, and how common are they?
So fibroids are non-cancerous or benign growths in the uterus. They can occur throughout the uterus, and what they are solid muscle growths. They're made out of a type of muscle called smooth muscle.
Who's at risk for these?
All women, basically up to menopause, are at risk for these. They're very common. It is estimated that up to 70% of women will have fibroids at some point in their life up to menopause.
Are there different kinds of fibroids at different locations?
Yeah, so as I mentioned, they can occur throughout the uterus. We have different names for them depending on their location, but if they're in the cavity of the uterus, they're called submucosal. If they're in the muscle, intramural, and subserosal on the most outer portion of the uterus.
Do we know what causes these uterine fibroids?
You know, we don't know for sure. We think there's some type of genetic predisposition. There's evidence that there's a play with growth factors and our natural hormones that we make in our body, but we haven't been able to target exactly why certain women develop fibroids.
Does pregnancy or no pregnancy have anything to do with this?
Not really, because women who have never had children before experience large fibroids, and women who have had children before also can experience fibroids.
And age groups that are affected? You had said something about after menopause, not as much, but are younger women as opposed to middle-aged women, any age difference in finding these?
So as far as like symptoms, we see a lot of symptomatic women between the ages of like 25 and 45. I feel like that's when most women are presenting with symptoms. Fibroids can grow up until the time of menopause, at which time our natural hormones decline in the menopausal process, so you're not going to get any additional growth of fibroids beyond that point.
What are symptoms?
So symptoms of fibroids are very commonly heavy or prolonged uterine bleeding, pelvic pressure, increased pelvic cramping during your menstrual cycle. Some women will notice that their abdomen is distended and hard from the actual growths. Some women notice that they're urinating more frequently from pressure from the fibroids or having constipation. Other women may discover this as they're trying to conceive, and they may experience infertility due to certain type of fibroids.
That was going to be my next question. So that can be a factor
to
infertility.
Yeah, it can be a factor. I would say for the majority of women with fibroids, they're able to conceive and carry a pregnancy with fibroids in place, but depending on their size and location, they can impact a woman's fertility.
When should a woman seek care for fibroids?
Really, when they start to affect your quality of life. So ideally, adult women should be seeing their gynecologist annually for a routine exam, because oftentimes they're discovered during those exams or through discussion of symptoms. You start to suspect that fibroids may be there. But once they're discovered, we typically follow them. And generally, once we know they're there, when they begin to affect a woman's ability to just enjoy their normal function, they're having, without having heavy bleeding or pain, that's when it's a good time to come in for treatment.
And what are treatment options?
So there's a multitude of treatment options that are available. They include medications, which mainly treat heavy bleeding. And then there's interventional procedures as well as surgical procedures that are available.
Can you tell us some of those minimally invasive ones?
Minimally invasive options include a procedure called a uterine fibroid embolization, where this procedure is done by an interventional radiologist, where they're able to access the blood flow to a fibroid and use a material to block that blood flow, therefore decreasing the size and symptoms of the fibroid. Another is a procedure called transcervical uterine fibroid ablation. This is a newer technology where we're able to use an ultrasound to view the fibroids, and that ultrasound probe then allows us to ablate or burn the fibroid tissue, thus making them inactive and decreasing the size.
You mentioned TRA. Where can women get this?
Our clinic at The Ohio State University is only one of two places in Central Ohio you can find this technology.
who is eligible for the minimally invasive treatments?
So it depends on a patient's goals for care as well as the type of fibroids that they have. Most women are eligible for one of those treatments, but there are a couple types of fibroids in certain women who wouldn't be able to access or wouldn't be the best option for them.
Tell me a little bit about the expertise here and the fibroid clinic that offers this expertise.
So at our multidisciplinary fibroid clinic, we have a group of experts in uterine fibroids, which include gynecologists, interventional radiologists, diagnostic radiologists, and infertility specialists who are really passionate about the care of fibroids. This is a unique clinic to OSU. You're not going to find this group all together in one area and able to easily collaborate to provide comprehensive care for fibroids.
Why is that important, to have this collaborative care, everything in one place?
Because every woman's needs are so unique. Whereas, one woman may have concerns about how this impacts fertility, one woman may not have that, and just having all of the expertise together allows us to easily be able to view every patient through the lens of multiple subspecialists and really get a good view of what would be the best treatment for them.
When we talked about symptoms, you mentioned gestation in the stomach. Is there weight gain that comes with any symptoms?
So not necessarily weight gain. The abdominal distension that is seen with uterine fibroids is really due to the size of the fibroids and it just protruding the abdomen, but fibroids themselves do not cause weight gain.
Thank you, Dr. Bondurant, and thank you for joining us for Health Talks.